Here are the details that every American needs to know about this plan. First, if you are among the hundreds of millions of Americans who already have health insurance, nothing in this plan will require you or your employer to change the coverage of the doctor you have. Under this plan, it will be against the law for insurance companies to deny you coverage because of a pre-existing condition. As soon as I sign this bill, it will be against the law for insurance companies to drop your coverage when you get sick or water it down when you need it the most. They will no longer be able to place some arbitrary cap on the amount of coverage you can receive in a given year or in a lifetime. We will place a limit on how much you can be charged for out-of-pocket expenses, because in the United States of America, no one should go broke because they get sick. And insurance companies will be required to cover, with no extra charge, routine checkups and preventive care, like mammograms and colonoscopies, because there's no reason we shouldn't be catching diseases like breast cancer and colon cancer before they get worse. If you lose your job or you change your job, you'll be able to get coverage. If you strike out on your own and start a small business, you'll be able to get coverage. We'll do this by creating a new insurance exchange, a marketplace where individuals and small businesses will be able to shop for health insurance at competitive prices. Now, for those individuals and small businesses who still can't afford the lower-priced insurance available in the exchange, we'll provide tax credits, the size of which will be based on your need. For those Americans who can't get insurance today because they have pre-existing medical conditions, we will immediately offer low-cost coverage that will protect you against financial ruin if you become seriously ill. This was a good idea when Senator John McCain proposed it in the campaign. It's a good idea now, and we should all embrace it. But an additional step we can take to keep insurance companies honest is by making a not-for-profit public option available in the insurance exchange. Let me be clear, it would only be an option for those who don't have insurance. No one would be forced to choose it. It would also keep pressure on private insurers to keep their policies affordable and treat their customers better. I will not sign a plan that adds one dime to our deficits, either now or in the future. We've estimated that most of this plan can be paid for by finding savings within the existing healthcare system, a system that is currently full of waste and abuse. The only thing this plan would eliminate is the hundreds of billions of dollars in waste and fraud, as well as unwarranted subsidies in Medicare that go to insurance companies. And we will also create an independent commission of doctors and medical experts charged with identifying more waste in the years ahead. These steps will ensure that you, America's seniors, get the benefits you've been promised. And we can use some of the savings to fill the gap in coverage that forces too many seniors to pay thousands of dollars a year out of their own pockets for prescription drugs. Many in this chamber, particularly on the Republican side of the aisle, have long insisted that reforming our medical malpractice laws can help bring down the costs of health care. I know that the Bush administration considered authorizing demonstration projects in individual states to test these ideas. I think it's a good idea, and I'm directing my Secretary of Health and Human Services to move forward on this initiative today. The time for bickering is over. The time for games has passed. Now is the season for action. Now is when we must bring the best ideas of both parties together and show the American people that we can still do what we were sent here to do. Now is the time to deliver on health care.
The United States lags behind all other Western countries when it comes to access to affordable health care for its people. Universal health care, a norm in many other countries, has not yet been accessible here in the United States. So the question is affordable health care a privilege or a right? And why is health care and insurance so expensive? And ultimately, what about the Affordable Care Act, which was passed in 2010 due to be implemented in 2014? What are its short-term and long-term consequences and implications? The answer to those questions and more on this edition of Inside Out. According to the 2011 census report, over 48 million Americans don't have health insurance. These people have limited options when it comes to seeking medical treatment and risk taking on enormous bills. This means approximately 48,000 people died needlessly last year because they couldn't get access to timely and appropriate care. A report by Health Affairs found that more than 25 million of Americans were underinsured. This means that even though they have health insurance, it does not fully cover all their medical expenses, and they must pay a large portion out of pocket. Katie Robbins is a board member of Healthcare Now, an organization calling for healthcare reform in America through a national single-payer healthcare system. She says, in these hard economic times, anyone can be affected by the current healthcare system.
Being uninsured can really happen to anyone in this country. I mean, we have a huge number of the 50 million people who are estimated to be uninsured right now, who are children, who are veterans, mostly women, people of color. Immigrants certainly have challenges in accessing insurance. And historically, the United States has relied on employer-based healthcare. You have to have a job in order to have health insurance. Once you lose your job, probably because you get sick and can't continue working, that's when you lose your health insurance, when you most need it.
Dr. Laura Boylan is Clinical Associate Professor of Neurology at New York University School of Medicine. She practices at the Department of Veterans Affairs and at several Pennsylvania hospitals, in addition to speaking and writing on policy, ethics, and other social aspects of medicine and healthcare. She says those who can't afford immediate treatment don't have many affordable options.
So you have the right to get the care, and your care will not be delayed. So you have a right to get a basic medical evaluation and a plan set up. But what happens is you'll get the bill, which can be easily $1,000 for a trip to the emergency room. And, it goes downhill from there, because then you get the hospital, and hospitals, as the thumb screws are on in the healthcare system for costs, the hospitals have been getting nastier with their collections. And they're going through collections just like a used car company would.
And undocumented immigrants are often more vulnerable than other groups.
Undocumented workers have a difficult time accessing health care in terms of coverage, but they still end up, of course, if they get sick, getting treated, and often getting treated at the hospitals, which is an expensive way to do it. That's actually the way I got involved with the issue 30 years ago with migrant farm workers out in Arizona who were literally dying because Arizona at that point was the only state without Medicaid, and they wouldn't treat them out in Sun City, which is sort of the richer retirement community outside of Phoenix, and they would ship them for an hour by ambulance into the county general hospital, and sometimes they would die on the way in.
Mark Dunlew is Executive Director of Hunger Action Network, an organization that has the dual goal of reducing hunger today while promoting long-term solutions such as universal health care, living wage jobs, and affordable housing for those in need.
We run food pantries and soup kitchens in New York State. We feed about 3 million people, and about 40% of them are the working poor. And those are the people who have jobs but don't make a lot of money, but often do not get any type of fringe benefits, that end up without any type of health care coverage. There's like 3 things that really drive people to the food pantries and soup kitchens. I mean, one obviously is just a lack of income, but the 3 bills tend to be the rent bill, the utility bill, and then the health care bills.
And the recent economic recession has had a direct impact to access to affordable health care and insurance.
There's a system called COBRA, which is available to people when they lose their job. They can pay a certain amount of money a month to keep their health insurance, but the COBRA payments every month often exceed what people will get in unemployment payments. So it's actually an unaffordable safety net. It's something that most people can't afford to buy, to have that kind of coverage between losing their health insurance and when they next get a job and gain health insurance again.
Now, there is the option of Medicare for certain people and families with low incomes and resources. The program is jointly funded by the state and federal governments. However, only U.S. citizens or legal residents can apply, as well as low-income adults, their children, and people with certain disabilities. Poverty alone does not necessarily qualify someone for Medicaid. That's one of the reasons why some 50.7 million people, 16% of the population, is uninsured.
When I look at the numbers, and I can't remember them off the top of my head, but I remember the first time I looked at the numbers on how poor you had to be to get Medicaid, and I thought, oh my God, because all my patients had Medicaid. I had no idea everybody was really that poor, because it's not just a little pinched. It's seriously poor.
The only way to get long-term care, for the most part in this country, is through Medicaid. So it really serves everyone. All of us are completely uninsured when it comes to long-term care.
According to Robbins, another reason for the broken down healthcare system in America is that private insurance companies are relying on healthcare as a means for profit.
I think the way the healthcare system has evolved in this country has become an excellent example of commodifying a public good. The U.S. has rejected ideas of moving to a national health insurance program, truly equitable health insurance program, mainly because there are people making a lot of money off of the system as it is. We rely on private health insurance companies which are largely for-profit. Historically, they were non-profit, but since the 80s, they've become these huge multinational for-profit institutions, and they make money essentially off of denying people health care. The insurance companies can deny actually paying for care. So if your doctor approves a certain kind of care, the insurance company can make up a reason why it's not the right kind of care for you and actually not pay for it. And also, the private health insurance plans that we have in this country have huge deductibles. For example, my family, we have a health insurance plan with a $15,000 deductible annually. We will have to pay our $200 a month in premiums and then $15,000 out of pocket before the insurance company pays a cent for our care.
The Affordable Care Act, passed in March 2010, seeks to fix the healthcare system in America. The White House lists 4 main goals of this reform: stronger consumer rights and protections, more affordable coverage, better access to care, and stronger Medicare. The most controversial aspect of the bill is its individual responsibility component that requires every citizen to buy health insurance or face a tax penalty.
If you're one of the 30 million Americans who don't yet have health insurance, starting in 2014, this law will offer you an array of quality, affordable private health insurance plans to choose from.
The law will deliver 20+ million new customers and $447 billion in taxpayer subsidies directly to the private health insurance companies, but leave at least 23 million uninsured and millions more underinsured with inadequate health insurance coverage.
The health insurance that you will buy will still be unaffordable, will still require very high co-pays and stuff like that. Plus, it would only cover a percentage of your healthcare costs. I think even the top brand lines cover maybe 70-75%. So people will find themselves not being able to pay their bills. They still make the decision, I really can't afford the copay at this point, especially if I'm paying 25% of the bill. I'm going to defer healthcare coverage. The United States spends 16-17% of our gross domestic product on healthcare compared to Europe, where it tends to average about 8%. Obamacare did not reduce the cost of healthcare, and that percentage will continue to increase.
The entrenchment of corporate control of healthcare is continuing to get worse. And even though we passed in 2010 what we call the Affordable Care Act, we're still going to see millions of people remain uninsured in this country. And despite the name, healthcare will largely be unaffordable for people. If you're not, however, on a public program, Medicare or Medicaid, then you are mandated to buy private health insurance from these for-profit companies, essentially. If an insurance company charges you more than 8% of your income for health insurance, you're exempted from the mandate to buy health insurance, which means you can remain uninsured and not be fined for being uninsured. So I think that a lot of people who are likely older or who have healthcare problems are going to fall into this pool of kind of like a donut hole. If you have the money or make sacrifices on rent or food or other things, then you spend all your money on health insurance. But if you don't do that, then you're not going to be fined for not having it.
So you won't be fined, but you will also continue to not have health insurance.
The Congressional Budget Office estimated that 30 million people will be uninsured when this is fully implemented. But I would estimate that it's going to be higher.
The law had its origin in the Right-Wing Heritage Foundation and was first put into practice in 2006 in Massachusetts by then-Governor Mitt Romney and was solidified into federal law after corporate lobbyists wrote legislation with more than 2,000 pages. According to Truth columnist Chris Hedges, quote, "It is a law that forces American citizens to buy a deeply defective product from private insurance companies. It is a law that is the equivalent of the bank bailout bill, some $447 billion in subsidies for insurance interests alone for the pharmaceutical and insurance industries. And it is a law by which President Barack Obama and his corporate backers extinguished the possibilities of both the public option and Medicare for all Americans."
The Obama plan came out of a massive lobbying effort such as had never been seen before. The pharmaceutical industry and the health insurance industry were major players. I'm of the personal belief that the pharmaceutical industry is more important than the health insurance industry, but those were both big players and big winners in this round.
In this recent session of the healthcare debate, which led to the passage of the Affordable Care Act, the bill that we now know, or the law that we now know as the Affordable Care Act, was really written by Senator Max Baucus's chief health legislative aide, Liz Fowler, who worked for WellPoint prior to taking her position with Senator Baucus. She had a lot to do with the rewriting of the bill and the legislation that we know. So it was really written by and for the health insurance companies and the corporate interests.
Public health advocates and many grassroots organizations believe that the bill will not solve the country's healthcare problems, and the solution lies in what is called single-payer healthcare, which is medical care funded from a single insurance pool run by the state. A single-payer universal healthcare plan for an entire population can be financed from a pool to which many parties, employees, and employers in the state have contributed. Single-payer health insurance collects all medical fees and then pays for all services through a, quote, single government or government-related source. In wealthy nations, this kind of publicly managed insurance is typically extended to all citizens and legal residents. Examples include Australia's Medicare and Taiwan's national health insurance.
Its Achilles heel really is the absence of major cost control, because the plan delineates minimum benefits, but it doesn't control the cost of the health insurance. So by raising the required quality, it's going to raise the cost, which is not in the end going to help with access if people can't afford the insurance through the exchanges.
Mark Dunlew is also state legislative coordinator for Single Payer in New York, and he says the Affordable Care Act does not go far enough.
One of the things we do get upset about is that the American mainstream media, often report that a majority of Americans oppose Obamacare, and that's right. But what they don't report is the majority of those who oppose Obamacare oppose it for not going far enough. They don't oppose it because it's socialized medicine. They oppose it because it's not socialized medicine. And single payer is not socialized medicine, but people understand that Obamacare was a Band-Aid that didn't solve the problem, and we're going to have to come back to it.
He adds that through single-payer health care, everyone would be covered.
The insurance companies are the root problem with the American healthcare system. They are a cancer. They just suck up money and they reduce access to healthcare. They should just be gone, like they are in most of the other countries. And that every single person, regardless of employment status, regardless of their national origin, regardless of their age, regardless of their healthcare status, you get healthcare coverage, period. You need help, you go get it.
And the government would actually save money in the long run.
You'd off the top eliminate $400, $500 billion by eliminating the negative impact of the insurance companies. But the other thing is, once you actually provide health care to everybody, it makes a lot more sense for the government to save money by keeping people healthy. We don't have a health care system in America. We have a sick care system. We try to deal with illness once it occurs rather than preventing people from getting ill to begin with. And so many other problems would be solved if we had a universal health care system.
But the plan was off the table when the Affordable Care Act was up for debate.
The moneyed interests in Washington, D.C. were able to say, we're not going to talk about single payer. We're not going to talk about Medicare for all. We're going to talk about how to save our business model of providing private health insurance to more and more people. And because of just the power that money has in Washington, D.C., I think we were able to be swept aside.
But, you know, for instance, the single-payer groups very much disagreed with the public option approach. We thought it was an incredibly dumb political move, the worst Machiavellian mistake you could make. But the one thing that the public option people agreed to was under no circumstances would they support an insurance mandate. They would stand with the single-payer advocates and impose an insurance mandate. And then to see them a year later declaring an historic victory because their public option model, which undercut real health care reform and led to the more insurance mandates, they celebrate. It was like, what are you talking about? How Orwellian can you be? What you opposed 12 months ago is now a victory.
You know, we live in such an ideological time, I would say. You know, because this involves a government program, I think there's a lot of reflexive, this thing must be terrible, this thing must be stopped. You know, there's a lot of momentum politically for people who are very anti-government. I have a small dot of sympathy myself for this standpoint, but I do think there are some things that the government does better than the private sector.
In 2003, then-Senator Barack Obama actually supported a single-payer health care.
I happen to be a proponent of a single-payer universal health care plan. Everybody in? Nobody out. A single-payer health care plan, universal health care plan. That's what I'd like to see.
Later in 2010, President Obama called the plan unrealistic.
On one end of the spectrum, there are some who suggested scrapping our system of private insurance and replacing it with a government-run healthcare system. And though many other countries have such a system, in America it would be neither practical nor realistic.
I happen to personally believe that the Democrats are much of a party of the 1% as the Republican parties. I think the Democrats claim that they support workers, claim they support universal health care, but when they actually have the opportunity to vote for it, they don't do it, even though they'll tell you, you know, Ted Kennedy, Barack Obama, or Senator Schumer, well, of course, single payer makes the most sense, but we can't do it politically because the contributions from the insurance companies and the drug companies buy off too many of those other politicians. But we saw that in California.
However, there was a case in California when Republican Arnold Schwarzenegger was governor where Democrats would pass a single-payer health care bill and Arnold Schwarzenegger would veto it.
Once Schwarzenegger was no longer governor and Jerry Brown became governor, Suddenly the Democrats were no longer interested in passing a single-payer bill through the state legislature because they became very worried that, well, maybe Jerry Brown might sign this thing, so let's not send it to him.
According to the Institute of Medicine, America spent $2.6 trillion on healthcare last year. About $1 in every $6 went in the healthcare system. A third of that spending, a full $750 billion, did nothing to make anyone healthier. Instead, it was spent on unnecessary services, excessive administration costs, and fraud.
They say a third of our healthcare dollar is wasted on administrative overhead, profits, marketing, CEO salaries. So by cutting that out and actually providing healthcare to people through a Medicare for All system, we would save hundreds of billions of dollars.
Moreover, individual medical costs are the leading cause for bankruptcy in the United States today. A 2011 study done by Harvard University suggests that more than 62% of all personal bankruptcies are caused by the cost of overwhelming medical expenses. The Kaiser Family Foundation argues that uninsured and underinsured people put an enormous financial strain on the healthcare system as a whole. Those who step in to cover the cost of care to uninsured are struggling as the price of medical services has increased in the last few years. Dr. Laura Boylan is also a board member of Physicians for a National Health Program, a nonprofit research and education organization which supports single-payer national health insurance for all. She says that placing an emphasis on primary and preventive care would help level the cost of service in the years to come.
Well, if you had a real single-payer plan and everybody had access to medicine, then you could have people getting primary care and taking better care of their health from earlier on, and promoting a culture of health is going to be better in the long run.
And as always, we took to the streets to see what some people had to say about our topic of discussion today.
The healthcare system in America today, it works for some and doesn't for others.
What Obama did helped people a little bit, you know what I mean? People are able to have health care they didn't have before.
It's the most basic, essential thing that citizens of any country should have, that the government should provide for it, and it just doesn't. So what we have doesn't work. Obamacare has yet to be proven, so we'll have to see how that works out.
That's all the time we have for this edition of Inside Out. Thanks so much for staying with us and watching. Remember, you can always send me your emails to insideout@susanmadaris.com. I'm always looking forward to them. You can also follow me on Twitter for latest updates and discussions. Until next week and another show, from all of us here in New York City, goodbye.